Hi, I'm Dr. Taylor Pollei here with PharmMD Plastic Surgery and Aesthetics, and I want to talk for a minute about what the services that we have are and how they can be utilized in a kind of complementary, balanced way. As I mentioned before, not every patient is a surgical patient, and not all treatment offerings that we have can treat every single skin condition or aging type, but utilizing the appropriate treatment modality for what we're trying to fix is really the end goal. That's where having the experienced and qualified and capable team members and service providers there to educate, not sell, but educate patients on what we can do and what can actually be done is incredibly helpful. The way that I best view it is it kind of starts from the very beginning to the end, kind of like bookends. At the beginning, we have good skincare. We have our esthetician team where facials, dermaplaning, chemical peels, and really good medical grade skincare can be used to help that anti-aging and kind of help in that daily routine and daily regimen. Obviously, facials are done more often than facelifts or done more often than filler for a reason. It's more of kind of a maintenance and an esthetician level treatment. We kind of then move from there to other of the treatment modalities we have. And when I say treatment modalities, we're usually utilizing tech and a lot of lasers and other treatments to affect skin, to help collagen stimulation, to help tighten skin, help it look a little bit cleaner, a little more resurfaced, help pigment, help sunspots, help age spots, that kind of thing. So a lot of the treatments that we have here geared towards that are radiofrequency with microneedling. We have IPL, which is intense pulse light, or kind of that photofacial. We also have ablative or non-ablative CO2 and erbium YAG resurfacing. That I find is probably the most impactful when it comes to just that overall refreshing of the face. It's kind of that sanding down and kind of burnishing and creating that glow. We also have more targeted treatment modalities like laser hair removal, like pigment laser, and others that are along that same line, but more treating target areas. Now, pigment and spots and other things can be treated by good skincare, certain hydroquinone or non-hydroquinone lightening agents, and all that we have here, part of the service that we offer. But there are good lasers and techs and modalities for that. Jumping from there, we also have two rockstar, aesthetic nurse providers that are great with the injectables, neurotoxin being kind of the one category and dermal filler being the other. Neurotoxin obviously is kind of the umbrella name. Botox is the clear brand name that everyone recognizes, but Dysport, which is one that I personally utilize all the time, is one that falls right into that category, along with Xeomin, as well as some others that are new to market and coming soon that we'll see how much they are from a difference perspective in what they provide for an outcome. Obviously, that's more for the muscle movement lines and different treatment areas. When it comes to the volumizing, that's more the dermal fillers. Allergan and Galderma are probably the two largest brands, but there's also RHA and others. And all of those product lines that are hyaluronic acid fillers are meant to add volume. So obviously a volume adding filler is going to be different than a neurotoxin and different than a laser resurfacing, laser hair removal, microneedling, radiofrequency skin tightening treatment. But they all are meant to work together in concert, separate from, but also including the surgical procedures. And we utilize that kind of menu or that kind of service offering list to really look at patients and say, okay, this is the best attack plan for you. This kind of daily care regimen coupled with this, laser modality treatment series, followed by filler and Botox and other things. I feel that that gives the best outcome to patients, and that's, from my perspective, the reason why setting up this kind of more aesthetic center surgical practice, combination is so beneficial for patients.